Jenn, someone asked, I'm a school teacher. Should I get antibody tested before I go back to school?
Okay.
What do you think?
Jenn's like, okay, that question.
All the past week.
Yeah, it's a really good question.
And I'll say, so not just for school teachers, but like a lot of people are asking, should I get tested? I had a thing in the fall. I had a thing in March.
Yeah. I think the important question to ask right now is, what would you do with that information? So, would you change your behavior? And if, the answer is that you shouldn't change your behavior right now based on these antibody tests, because they're just not reliable enough.
So can you, before we dive into that, can you just give us the once over of the difference between PCR and antibody testing?
Yeah, absolutely. So the PCR tests that are what we're giving people to test if they have the active infection. And that tests, that's the nasal swabs right now that go really deep into your brain. And what they need to do is get, the genetic
not actually deep into your brain.
It just feels that way.
Just really deep in your nose.
Looks like that.
Top tier for your nose.
Yeah, it looks like a nightmare. But what the idea is to get to test for the genetic material of the actual virus. So that means the virus is there and still replicating in you, and that would indicate an active infection and that you're potentially transmissible. If you had the virus several months ago and you've recovered, you're not going to test positive by the PCR test because your body has successfully eliminated the actual virus. But after a week or two of fighting the infection, your body will produce antibodies that we can measure in your blood. We don't have to measure them, luckily, through the nasal swab. And that, we use for lots of different infections, to test whether you've been exposed to certain things. And so it really, as long as your immunity, as long as your antibodies are there, it sort of indicates prior exposure. So it indicates prior exposure, but what it doesn't tell us for sure right now is whether you're immune. So that's an important thing. And we don't know right now just because the virus hasn't been, around long enough. So we haven't seen people re-exposed and, to see whether the antibodies protect them. We truly believe there will be some duration of of protection from antibodies based on other similar infections, but we can't say for sure. And, we don't know if it would just lessen the severity of a new infection or protect you entirely. And we don't know how long the antibodies would last. But the main reason right now why I wouldn't recommend antibody tests is that they're not accurate enough. I mean, first of all, there's a lot of tests out there, commercial tests right now with varying, degrees of reliability. But even the most reliable ones, they might say that they have 99% specificity, which sounds really good. But there's kind of this tricky thing in measuring the epidemiology of infections that when not a lot of people have the infection, and we sort of think, seroprevalence, which is what we call the percent of people we think have been exposed, in the whole country, is not very high. It might be on average 3% or 5%, in really hot spots like New York, it might have been 20%, but that's still 80% of people, who haven't been exposed. So if the overall prevalence is low in the population, a lot of people who test positive in the antibody tests are going to be false positives. And it is a little bit of a complicated epidemiology, problem set to show you why that's true. But I think we can do a post that works out some of that math. So the problem will be if you get a positive antibody.
Or if you can't do the math, just take our word for it. We can.
Yeah,
we'll show you how to do
it. Yeah, interesting, because it doesn't make sense if it's 99% specific. Why should there be so many false positives? But that's just because, if there's only 10% of the population has had it, then there's 900 people who might, should test negative. But if even 1% of them tests positive as a false positive, it's a lot of people. So the problem is, even if you get a positive test right now, I wouldn't change my behavior based on that, because there's a good likelihood that it's a false positive. And that's going to stay true, for a while the prevalence is low, and especially until these tests get a little bit better or they make follow-up tests. So sometimes we have screening tests that have a lot of false positives, like I don't know if it's not the same prenatal testing, but I remember when I was pregnant, those, blood tests that would screen for genetic abnormalities, and a lot of people would test positive and then have to have a follow-up like amniocentesis, or I think those tests have changed, but that's the same idea. Sometimes screening tests give a lot of false positives, and then you do something that's a little more sensitive, but that would require follow-up tests, and we're not.
Another good example that a lot of our viewers will be familiar with is mammography. There are a lot of false positives on a mammogram, and then if you get something suspicious on a mammogram, you go in for follow-up, and in most cases that follow-up, it turns out everything is fine.
So sorry, I'm going on as if it's an epidemiology lecture, but no, bottom line is they're not accurate enough right now to change your behavior, or to decide that you're not going to infect someone because you've already had it. So it could be a curiosity, but even then, like, if whatever result you got, I would still be skeptical of it. So I think when we as the nerdy girls think that there's a good test out there, we'll let you guys know, and and give our updated advice on that. But right now, it's not worth the money.
And it's a lot of money.
Yeah.
Yeah.
Excellent.